Hi there, I'm Shani. I'm your nurse. I wanted to come in and talk with you again about your diagnosis of CHF. And I wanted to talk with you and go over some things about how I can help you manage it on a daily basis once you're discharged here from this facility. I actually brought some tools to help you once you go home keep track of everything that you're taking in on a regular basis. So I know that we went over together already some of the foods, that you want to avoid, some of the things that you can incorporate in your diet. And then I also know that we talked about how to, go through labels, look at labels and discuss and figure out with yourself about the things that you want to look at on the labels, such as the sodium content and how, if you can't find it, where to find it. So now that we've done all of that, I wanted to bring you a journal as well as a writing utensil to keep close with you at all times. I want to help make this with you so that it is something that you will utilize on a regular basis and something that you will find effective for you when you're trying to manage your diet. So I made sure that it was small enough for you to carry around until you get used to it. Some of the things that I wanted to talk to you about is that how important it is to make sure that you're maintaining this every day. When you're going to follow-up appointments with physicians, when you're doing things like that, it's very important for you to keep track of your sodium intake and do it regularly, so that way your doctor can, adjust medications and make sure that you're adhering to it as he has prescribed. So I know that we talked earlier and you said that your physician had asked that you try to maintain a 3,000 milligram per day sodium diet. So in saying that, the way that I think it would be best for you is at the top of your journal and on the front as well, I wrote 3,000 milligrams per day of sodium. All right. So I feel as though if you follow this every day, and again I put it on the front, I feel as though if you follow it every day, you will have the ability to make sure that it's consistent throughout for when you go to a follow-up appointment. Now, in saying that, I feel like it's best to separate your day based on how you eat every day. So if you eat breakfast, then you eat a snack, then lunch, then a snack, then dinner. Follow your journal in that respect. So however your eating habits are. So how do you normally eat? Just breakfast, lunch, dinner? Okay, with a snack in between. Okay, so we're gonna label your journal with breakfast, and then lunch, and then dinner. And then on the bottom, I feel as though it would be most appropriate to just have a snack column, and then that way you can put things there as you go throughout the day. So say for instance, when you're having breakfast, let's say that when you're having breakfast, you have eggs and bacon. What you should do is make sure that you're maintaining serving size as well as the amount per serving. So each label, as we discussed, will have a serving size listed on each label. So if, for instance, you have one slice of bacon, and on the back of the package it says that the serving size is 2 slices of bacon, you're only going to take half the amount of sodium when you're calculating. So that's something that's very important to pay attention to. So make sure that you have a column, and as you can see, I've labeled, you have breakfast, lunch, dinner, and then a snack column, and then also a serving size and then amount per serving. Now, it's very important that we keep a tally so that at the end of the day we have the right amount. So our goal is to never exceed 3,000, as we talked about. So here you'll see I have labeled we're having eggs and bacon for breakfast. Now let's see, for lunch you're having a turkey sandwich. It's most appropriate to not write turkey sandwich and to actually individualize each item. So if you have turkey on the bread, turkey and cheese and bread, and then chips. So as you can see, and please remember, condiments include sodium as well. So everything that you're putting on, please make sure that you're identifying on your list here. So in this case, if you have turkey, cheese, bread, and chips, the components of your lunch, make sure that each slice of turkey is noted, and then make sure that if you're having 2 slices of cheese versus 1 slice of cheese, you're making sure that you're documenting that and then taking that sodium into account. For dinner, say you're having a chicken breast and you're having salad. When you're making your salad, please make sure that you take into account anything that you put on top of the salad, just like with the sandwich. Make sure that you're not just labeling salad and only taking into account the lettuce. Make sure that you take into account the dressing and all the toppings that you're putting on the salad. And then say, for instance, you wanted to have a popsicle or a cookie in between, put that in your miscellaneous column, and then make sure that you're identifying what the serving size is. So if you're having 2 eggs, or you're having 4 eggs, or you're having 3 popsicles, make sure that you're identifying that, and then that you're adding that up based on the amount per serving. So once you've tallied all of this up, say every single time throughout the day, you're saying that your eggs, however much sodium is in each item that you'll find on the back of the labels. And again, we went over how you can look up online, or how you can check with the CDC, or there are other sites that you can check with if you need to look up how much salt is in each serving or sodium is in each serving if you're unable to obtain it from the label. So in saying that, this is something that you need to keep close with you every day, and make sure that you're keeping an actual, a journal every day of everything that you're taking in. So that way you have a close monitor, and this is actually something that you'll keep with you all the time. So that way going forward, you are always able to say, okay, can I have this, or can't I have this? Will this fit into my diet and what I'm allowed to have daily? And then also, in doing so, there are several pages. And so the way of doing this is to make sure that the previous day's log, you keep an account and make sure that the total on the bottom is you're going to keep track of it. So you want to make sure that you're always staying, like we talked about, under the 3,000 milligram mark. So that way that you're matching what your doctor has requested for you to go forward. And then, like I said, make sure that going forward, every day you try to make your log look the same, so that way it's very easy for you to access and your physician to access, so that way going forward you know how you do on a daily basis, and your doctor can adjust things accordingly. So I'm going to give you this journal and this pen, and I'm going to ask at this point if you have any questions, or if there's anything that I can do to help you understand or facilitate this better for you. I feel like this is probably the best thing for you. So what I would like at this point for you to do is to please show me how you would document what it is that you're having for lunch today. So in this case, you're having a plate of spaghetti and a dinner roll. So tell me, how would you document it on this? And then let me watch you do it, so that I can make sure that, or so that we can together go through it and make sure that you don't have any questions. Okay, so the patient has provided a return demonstration, and now so now I would like for the patient to, after going through it with you, I would like to ask if you have, and the patient, you have any questions at this time, if there's anything that I can do to help with the process, or if there's anything that I can do to make it easier for you to understand. No question? Thank you so much for taking the time to learn about how to monitor daily sodium intake using a journal.